My name is Dr. Joseph Kaye. I operate a practice called Optimal Wellness MD. We're in Woburn, Massachusetts, and we've been here about 11 years. We focus on functional medicine, integrative medicine, and for the past several years, we've also included treatments for erectile dysfunction, specifically GainsWave and the P-Shot. We've been optimizing testosterone for over 10 years, so we have a big practice focusing on that. And we also focus on nutrition and lifestyle and diet factors that can improve your health and improve erection function. GainsWave is a really interesting technology. It delivers high intensity sound waves to wherever you want to aim them using the GainsWave device. So although we use it for erectile dysfunction, GainsWave also works on other parts of the body that might be injured, such as muscle damage, and there are even some studies showing it can improve blood flow to the heart. But in our practice, we focus GainsWave on the penis because we want to improve the blood flow to the penis and give men better erections. So the way it works is that sound wave makes the stem cells in your penis start to wake up and repair damage, and they repair the damage in the blood vessels and the nerves and the structural tissues, and at the end you have a penis that is healthier and is capable of getting better erections. In terms of who is the ideal candidate, I always say the ideal candidate is a guy who wants better erections. It really doesn't matter how old you or young you are, frankly. I've treated men as young as 23 and as old as 80. Many times the younger guys, while they can get erections, they want harder erections, they want a bigger penis, believe it or not. So the P-Shot and some of the techniques that we use here can actually help that happen. More commonly, we see men in their 40 to 60 age, where they're starting to feel the effects of age, where testosterone may be starting to decline a bit. Maybe they're in a new relationship, a second marriage, or something like that, and they want to be able to perform at their best. So that often prompts them to call us and sign up as a patient. I've also treated men in their 70s, and some of them do remarkably well. Men in their 70s may have more medical problems. They might have overweight, they might have some diabetes, they might be on medication for high blood pressure or heart condition. So I have to really use my internal medicine hat to work with those medications and maybe suggest alternatives. We have a nutritionist who can help them with their diet and losing weight. And then we often will have to do more GainsWave treatments and P-Shots than we would in, say, a 20 or 30-year-old, maybe 12 treatments instead of 6. But I've seen very good results in men in that age group, particularly when we optimize their testosterone, which is often quite low. That's a very easy question. There aren't any, only good ones. Yes, GainsWave actually works, and so does the P-Shot. There have been many studies testing this technology over the past 2 decades. On my website at Optimal Wellness MD, I reference a number of these studies on our section devoted to the P-Shot and GainsWave. Patients can click on those links and look at these studies themselves. But the studies are pretty consistent. You get about 75% of men who get a single course of GainsWave treatments with a significant improvement in erections. We use a score that goes from 5 to 25. 5 is terrible, 25 is perfect. And you usually see about a 7-point increase on average after 1 round of GainsWave treatments. I have found in our office, tracking our own patient data, that we get about the same response rate, perhaps 70 to 80%. We'll get a significant improvement. But when we combine it with the P-Shot, we see even better results. And if you then combine it with improving diet and lifestyle and adding supplements and optimizing testosterone, you can even get better than that. Virtually everybody has a significant improvement in erection quality. We have I will reference here that we'll include in this talk. that shows in close-up what happens in our patients when they get the P-Shot and the GainsWave versus just the GainsWave alone. And you can see on both graphs, there's a dramatic trend upward towards those higher numbers, regardless of which treatment you get. Most of our patients get both the GainsWave and the P-Shot, so there are more lines on that graph, but the general trend is upward towards that 25 number in both groups. Maintenance is important, just like you would maintain your car or get a haircut or shave. I recommend getting another GainsWave treatment maybe every quarter, maybe every 6 months, whatever works for you. I think that's the best way to keep your gains, literally. Well, the question of whether you should wait, it really depends on your circumstances. If you can deal with a medical problem early, it's always better and easier to treat, whether it's your blood pressure or your weight or hair loss or ED. The younger and healthier you are, the quicker and easier it is to get good results with treatment. If you wait, things will continue to progress. It'll probably get worse, and it may be harder to fix when you finally do decide to seek help. So I always encourage everybody, address it early, and you'll have a much better quality of life going forward. I would suggest that if you're interested in booking an appointment, you can go to our webpage, which is www.optimalwellnessmd.com. You'll find our phone number there, which is 781-933-4200. You can call and speak to my very helpful assistants who are well-versed in GainsWave and P-Shot and able to talk to you all about it. And if you're interested, we have a YouTube channel as well, also under Optimal Wellness MD, where you can watch me doing the procedures. Watch me do the P-Shot, watch me do the GainsWave, as well as watch me do a lot of other procedures such as hormone pellet implants that we do here at our office. A lot of these videos are included in our website. So if you just go to our website and scroll through, you can watch these things. All right, my pleasure.